it's not a problem to get your ROI on this device. If you package it well, you market it well, people see and feel the results because they are pretty instantaneous. Individuals that have had pain for years, I'm seeing that they're getting significant relief with the cryotherapy, and they've been coming back and doing it on the regular. It's a great tool for the cost of it, for the portability of it, for the effectiveness of it. I think all around it's just been a really good tool to have. Very easy to use. The training modules that America Cryo has are very, very good as well. I would recommend 100% do it.
This is Dr. Keith Lee. He's a DPT. He's NY-based, New York-based PT specializing in sports injury and athletic recovery. He's the co-founder of Recovery Mode in NYC. So it's a Recovery Mode NYC. He's also a sports recovery, and he owns a sports and recovery wellness facility specializing in sports therapy and biohacking technology. That's a lot of modalities out there. So Dr. Lee, go ahead and introduce yourself and tell us all the services that you do.
Yeah, so my name is Dr. Keith Lee. I'm a physical therapist. I've been a physical therapist for about 8 years now. I came from a traditional orthopedic setting, and I found that there was a gap in care. There was a gap in that highly active individuals weren't able to really get adequate care. It was either, if you're getting physical therapy from a traditional setting, you're very low functioning, you are, unable to walk, unable to climb stairs, very, very, very activities of daily living based, and not so much based on the needs of an athlete or of someone that runs or someone that goes to the gym. So we created Recovery Mode to help people who are active stay active. And with that being said, our services here, we focus on sports manual therapy, sports massage, stretching, assisted stretching, the localized cryotherapy. We have cold plunge, infrared sauna. We have leg compression, oxygen. So we have a couple of different technologies that facilitate recovery, facilitate an active lifestyle, and allow people to take care of themselves and come back from intense training more efficiently, more effectively, prevent injury. So we're definitely more on the proactive, preventative side of things versus the reactive, let's fix it after it's injured, right? So we're more of the preventative side of things, and again, keeping people active, keeping people in the gym, keeping people running, keeping people doing the things that they love.
Yeah, that's amazing, because like you said, this is preventive and maintaining the abilities that they already have, especially like a lot of athletes. So when all these modalities that you have, before you went into Subzero, the cryotherapy, what made you decide to have the localized cryotherapy as part of the modalities that you offer for your clientele, for your patients?
Yeah, I think that I'm a big believer. The way that we work here at Recovery Mode, we're very targeted. We want to listen to our clients, right? I think more times than not, you'll have a patient or a client come and say, you know what, like I've had this pain and no one's been able to figure it out. I get different diagnoses from doctors. I get images. No one can find what's wrong. And it's mainly because people aren't being listened to. Their specific issues aren't being addressed, right? So I feel like here we like to listen to our clients. We like to actually put our hands on what's bothering you, and with the localized cryotherapy, I could target specific areas, right? I can target inflammation, I can target pain, and it's very specialized and customized for the client. So we pride ourselves in being able to customize our care and not go with a cookie cutter one size fits all treatment, right? We
Yes.
want to really listen and fill the needs of the specific person that's in front of us. So whether it be a runner, whether it be someone that does CrossFit, right? They all have different needs, and we should be able to address those needs of that physically active person. And the cryotherapy has been a really good tool in that.
Yeah. Like you said, this is like a treatment plan for each individualized clientele or patient that
Yeah.
you have, which is great because, like you said, the size doesn't fit all, right? Some people need this, some people need a certain modality. So having that different modalities that you offer in your recovery facility is great. So you can customize what they need. So what can an athlete benefit from? I know we know this because this is our space
Yeah.
of cryotherapy, but for some people out there who doesn't know what are the benefits of cryotherapy for an athlete, can you elaborate that, please?
Yeah, so I think the main thing that we have to understand about pain is that it's nervous system based, right? Pain is a perception. So when it comes to a physically active individual who trains a lot, who trains intensely, their nervous system is very high. It's ramped up, it's at a high level, and a lot of times the pain experience comes from that nervous system being in a state of fight or flight.
Mhm.
So with the cryotherapy, what it does so effectively is that it can lower that sensitivity. It can lower that fight or flight stressed out state and bring it down to a more restful, parasympathetic, healing, and promote that recovery. So it's number one, you get instantaneous pain relief. And then number two, you get that desensitization and that lowering of that nervous system. And then you also get the anti-inflammatory benefits.
Yes, yeah, correct. Yes, it's just for a lot of people who doesn't know about the benefits of cryotherapy, like what Dr. Lee said, it has this anti-inflammatory effect. And for a lot of athletes, because we see athletes here as well, so they don't realize that, okay, the pain is caused by inflammation and
Mm-hmm.
they don't understand. So uh, with that, with you diving into Subzero, what side effects or what are the changes you have seen so far? Because we've seen your video that you posted with
Yeah.
using the Sub-Zero. What was the effect on that specific patient when you were doing the Sub-Zero?
Yeah. So that specific patient, he was obviously training very, very hard, very intensely. And again, it's when you're training at that high level, your nervous system and your muscles become in that state of, they're stuck in that state of stress. So what
Mm,
does that mean? It means that the nervous system is preventing that individual from doing that activity again because it's threatening,
mm,
right? It's stressful. So the Sub-Zero really lowers that threshold down, and then instantaneously opens up range of motion. They can
mm,
move better.
mm,
Their nervous system isn't in threat anymore. The pain goes down. So then that opens up a window of opportunity to work on exercises, mobility, stretching,
mm,
and it does so in a safe way so that the nervous system's calmed down, the inflammation is down, the pain is down,
mm,
and then it promotes that healthy state for that person to get back into that activity.
mhm. Yes, that's right. So, Dr. Lee, there are a lot of people are very, very hesitant about cryotherapy. Most of the time, they'll say, "Oh, you can just do ice bath." It's the same thing as ice pack. What do you say when somebody comment? Have you experienced that comment before? Oh, you can just do ice pack. What?
Yeah. I think again, I have a cold plunge here as well, so I have both, right?
Yes.
I have the cold plunge, I have the localized cryotherapy, and it basically comes down to specificity, right? Like
Mm-hmm.
if I want to be very intentional and be specific with where I want the cold to be, I'm going to use the localized cryotherapy, right? If I want to promote generalized, benefits, anti-inflammatory benefits, and then with the cold plunge, that's what it does. It, you know, paired with like breath work, it's really more of a systemic benefit and general wellness benefit that you get from the cold plunge, versus the cryotherapy is more of a specific, intentional, targeted treatment. So, you know, you're looking at what's my intent and what am I trying to really accomplish. And also with the cryotherapy, it's high pressure, right? So you have the penetrative air pressure that goes into the tissue. So in that case, it's better than the cold plunge in the way that it targets the tissue.
Yeah, I completely agree. And plus, it's faster. If you're doing ice bath,
100%. Yeah, faster, instantaneous. Yeah,
yes,
it's
yes.
really efficient. Yeah.
So everyone who's joining us in our live, I'm gonna go ahead and wave at you. So if you have any questions for Dr. Lee, go ahead and just drop your comments below, and we will be answering your questions. All right, I'm gonna wave to all of you. Thank you so much for joining us. So Dr. Lee, for pain management, do you see a lot of clients with injury? And what is the most injury that you see most and you treat with cryotherapy?
Oh man, that's a great question. I feel like it's just so versatile. It could treat anything.
Mm-hmm.
But I feel like where I've seen the best results are with people that have a lot of like joint pain. A lot of the clients that really enjoy it have you know, past history of knee pain, chronic knee
Mm-hmm.
pain, osteoarthritis, tennis elbow, any kind of like tendonitis.
Yes.
Those are the type of things that the cryotherapy has been really effective on treating.
Mm-hmm.
And then especially it's really well with like I said before, chronic pain.
Yes.
So individuals that have had pain for years and years, I'm seeing that they're getting significant relief with the cryotherapy, and it's they've been coming back and doing it on the regular to sustain that. So definitely more chronic inflammatory
Conditions, yeah. So we have a question right now. Let's go ahead and answer this question. Revive Wellness Place. When it comes to pain management, does he prefer to put people in packages or does he do a single service?
So yeah, that's a great question. The way the way that it's been working for my clinic is that we have it as a standalone service or an add-on. So people that, for example, if someone buys a sports massage package with me, a 10 pack, they may add cryotherapy to maybe 5 of those. It's a great add-on tool. So like maybe let's say for example I have a runner who's training for the marathon. The New York City Marathon is right around the corner. They're coming in. They have a chronic patellar tendonitis, and in some of the sessions they come really flared up. I'm going to add the localized cryotherapy to calm that inflammation down on top of my session, right? So it's a great tool to use depending on how your clients are presenting to me, right? How they're coming in, right? If they're flared up, if they train too much, or if you know, there's an inflammation, I'm able to integrate that cryotherapy into their session.
Yeah, it really depends on what they need. Yeah.
Yeah, it depends on what they need. It depends on how like again, we're dealing with active people, so you know, maybe they're training. Like I had an individual that ran 20 miles and they benefited from it because the 20 miles was a high level of physical stress on their body. So we're able to integrate that cryotherapy within their session, and that just makes our sessions more optimal and efficient, and giving that client that relief that they need so that they could bounce back and continue training without necessarily stopping their training. You're enabling people to keep going and recover faster.
Yeah, that's the yeah. I agree with you with the add-on because you're you're adding it into your existing service already, so that will benefit not just you but also your clients who need that modality, the
Yeah,
cryotherapy. So
and
that's
we
good.
usually recommend it
Yeah.
as we need it. So it's based on our clinical
Hmm.
observation. It's based on our assessment,
Hmm.
and it's not like we're just giving it to everyone, right? We're using it as needed, and we're using it, and it's been very effective in that way. And especially when you're dealing with people, like I said, that are training, they're active,
Hmm.
they're not resting, right?
Hmm.
These clients are very they need that care that gives them the fastest results.
Yes. Yes, that's good. All right. So let's answer the next question. That was a great question, by the way, Revive Wellness Place. So, Miss Nikki Body Shop, I have been thinking about adding this to my practice, but it is a big investment. How soon did you see a ROI?
That all depends on your marketing strategy,
Mm-hmm.
and it depends on the way that you integrate it within your business model. I would say that the just obviously the initial cost, to just to state, the initial cost is actually pretty affordable compared to the competition of localized cryotherapy. It's actually cheaper
Correct.
than most of what's out there. So just America Cryo probably you get the most bang for your buck with America Cryo. That's number
Correct.
one. Um, Number two is the tanks. I mean the tanks, the CO2 tanks. It cost me around $30,
Mm-hmm.
per tank, and one tank can give me about 5 to 6 sessions.
Mm-hmm.
So at depending on how you price it, you can definitely one tank it pays for itself after one session. So you're definitely multiplying your income on that one tank. But yeah, I think if you strategize it well, your return on investment can be pretty fast, especially
Mm-hmm.
if you package it well, you market it well, and then people see and feel the results because they are pretty instantaneous.
Mm-hmm.
Yeah, it's not a problem to get your ROI on this device, especially because it's so much lower price than what's out there
Yeah.
at the moment. Yeah.
Yeah, compared to the other cryotherapy device out there, yes, this is more cost effective. And so when we talk about market yourself, a lot of people are going to be curious about this because for us on the wellness like body sculpting space, we do market ourselves in a different way. So with you as a DPT and with focusing on pain management recovery, how do you market yourself out there? How do you market your business out there?
It's it's social media. Obviously, you have to have a social media presence. Educating. I mean, I post stories every day. I try.
Mm-hmm.
People really value the educational side of things. People want to learn. People want to understand their bodies better. They want to
Mhm.
be able to grab a hold of their health.
Mhm.
So I think providing value in the social media space by educating is definitely number one. And then just on a day-to-day basis, myself and the staff, we do a really good job in taking care of our clients and just really old school word of mouth.
Mhm.
The results speak for themselves. So if you're doing a good job and people are feeling the results, the work speaks for itself, and people will recommend you and send you people. So as long as you keep it honest, you keep it authentic, you keep it with the intent of really helping everyone that walks through your door, you'll have no problem in
Yes.
gaining more clientele.
Yes. And that is the best marketing out there is your clients. Like what we always say to our clients, you don't realize, but you're like a walking marketer for us. So we want to see the result. So when you see the result speaks for itself, and that's when a lot of your clients comes from referrals, right? Yeah.
Exactly.
So yeah. All right. So Hi, everyone who's just joining. If you have any more questions for us, please feel free to just comment down below and we'll do our best to answer your question. We have a great question over here. I am a massage therapist. This is Gold Wing Rocks. I'm a massage therapist for 25 years. I do a specific dip tissue massage and sports massage. I target specific injured areas. How does cryo work for whiplash and scar tissue within muscles?
Oh yeah, that's a great question.
Mm-hmm.
I mean, so let's see. The first part is
How does
cryo
work
work for
for
whiplash. Okay,
whiplash?
so yeah, so back to what I was saying about the nervous system, right?
Mm-hmm.
If you're doing manual therapy on somebody, you want the nervous system to respond positively to that, right? We want to promote healing. We want to initiate the natural healing process within that individual, right? Our hands, the techniques that we do, the treatments that we do, they all facilitate the individual to create that healing process for themselves. So for me, the cryotherapy brings the nervous system to a less stressed out state, and in doing that, your hands-on treatments, they may be more effective. Maybe that person's really sensitive, right?
Mm-hmm.
You can utilize the cryotherapy to desensitize that area before treatment, and then that'll allow you to do more with the client. You may be able to go deeper into the tissue, create more mobility, create more motion, um, and really provide that instantaneous pain relief with the cryotherapy. Additionally, you can use it as a way to alleviate post treatment soreness, right? So if you're doing scar tissue and you're breaking up tissue, that may cause pretty significant soreness in that individual. Now if you have the localized cryotherapy, you can offer that as a way to alleviate post treatment soreness as well. So you can use it before, you can use it after. It's really a good tool to modulate pain.
Yes, yes, that's right. Okay, that is a great question. Thank you for that question. All right, Dr. Devin B, can you explain the difference between the different color screw and tips? The red, blue, black, white cone, and when to use, or the other. Just received mine, I already love it, just want to use it correctly. Dr. Devin, thank you so much. Welcome to the Subzero family. We do have the online training. This is my first question, do you have access to the online training? If you don't, please direct message us, America Cryo, and we will send that link to you. Or there's actually a QR code that you can scan in the case of your device. But for the tips, I use the black for the cry slimming. It depends on the size because it's based on the size of your client. And also for the cone, I use the fog setting. What about you, Dr. Lee? What tip do you mostly use? Or for example, if it's a knee pain, what tip would you use?
I typically use the silver.
Mm-hmm.
I typically use the silver or the black.
Okay.
Those are the two I mean, obviously depending on the size of the client.
Yes.
But I think as a general one for orthopedic, I've been using the silver because it provides a nice steady stream it's strong, but it's also it's not so aggressive.
Mm-hmm.
It's like that happy medium. So I use the silver tip mostly. I have the silver tip on it right now. I don't really change the heads on it because I just feel like the silver tip is the best one for mine.
For some reason, it ended. We're back. For some reason, it ended automatically, but we're back. So, um, like I said, the tip for that I use is mostly black, and then like what Dr. Lee said, he normally use the silver one. So like I'm gonna show you mine. Like it's always connected with this one because this is what I use, and my other device it's for the fog setting. But Dr. Lee, so you left the conventional PT, DPT world, and then now you are a business owner, and you have your own business and all these modalities that you offer. What have you learned so far for all those PT, DPT, chiropractors who wants to start their own business like this recovery, is it a great choice for them to actually incorporate cryotherapy? Because it's not just the cryo chamber or cold plunge, but actually the Subzero. But like you said, like for me as a nurse and I'm starting a business, uh, this is more cost effective for me because it's more affordable compared to the other ones, which it does the job,
Mhm.
and we see the result for our clients. So what would be your message to DPT, PT out there who wants to leave the traditional uh, setting where they work out and start their own business?
Yeah, I mean, it's really up to the individual if they really want to break out of the traditional setting. I know I was burnt out as a PT working in a traditional setting. Being required to see multiple patients and at the same time, 3 to 4 patients at the same time. Um, that really burnt me out. So stepping away from that setting and being able to create a model that's more one-on-one, boutique based, cash based.
Mm-hmm.
That's if that's something that you feel like you can manage and do better for your clients, then 100% go for it. If you
Mm-hmm.
feel like you have more to offer, go for it, right? Like, there's only so much you can get and so much you can achieve when you're just focused on volume and just seeing people as it's like a factory, right?
Yes, yes,
If you really care and if you really are dedicated as a clinician, then you can totally do more and make a bigger impact if you were to go that route and set your own standards on how you want to treat your patients. So
yes,
definitely, like if you're tired of the same old and you want to do something different, I would recommend 100% do it.
yes.
Um, yeah. So I think the second question was how like integrating the cryotherapy, like
Mm-hmm.
so yeah, it's a great tool. It's portable. You can take it like if you're a travel PT, if you go to do home visits, you can bring. It's pretty easy to carry. It's you could take it to events and
Mm-hmm.
do promotions like that. It's a great tool. I think for the cost of it, for the portability of it, for the effectiveness of it, I think all around it's just been a really good tool to have. I don't have any complaints. I think it's yeah, it's people value it, people feel the results, and yeah, I enjoy having it. My the therapists at work here as well, they see really good results with it as well. Very easy to use. The training modules that America Cryo has are very, very good as well. So very quick to integrate, and you can integrate it seamlessly. It's not like rocket science
Yes.
to integrate. Yeah, very easy to use.
Yes, that's right. So I feel like we are in the same boat because I was burned out as a registered nurse in the hospital setting, and I feel like when I was working as a registered nurse in the hospitals, I feel like I'm not providing the good quality care that my patients need. So now having my time with our client and having that one-on-one, I feel like I am going home with the peace of mind that yes, it's not the traditional like I'm helping someone with chemotherapy or giving medication, but at the same time I'm making them feel like more confident and more, how I say this, because we do a lot of education to our clients, but just understanding what they go through, their body, and that value that we provide for them. I think now that I'm out of that traditional setting for as a nurse, I feel like it feels more rewarding to
Mm.
me. Yeah, because
Yeah.
of I don't feel burnt out, and then I can help one person at a time and not seeing seven patients at it's like juggling that
Mhm.
workload for them. So I feel what you feel. So I'm glad that you are in the space that you're helping all these clients of your patients of yours, very like you do their own treatment plan and you focus on what they really need. So we're happy for you that you're using Subzero Cryotherapy device. All right, we have more questions. All right, so Goldwing Rocks, she said, I'm burnt out as an LMT and I'm hoping this will help me with my current massage practice. What is the price range for you charge for cryotherapy? How much do you charge, Dr. Lee?
So a single session is $75.
Mm-hmm.
I'm in New York City, so I mean, if that puts anything into perspective, pretty big city. So we charge $75 within that treatment. We're doing a very thorough assessment. So obviously, with the localized cryotherapy, we want to be very intentional with our application. So that session will entail me doing an assessment, feeling around, palpating areas. I'm finding inflammation. I'm finding maybe some joint and mobility limitations. I'm identifying and strategizing my treatment. So half of the session is an assessment, and then the other half is the actual application, which doesn't take too long. So you're looking at around a 20 to 25 minute session for the cryotherapy. So you're about 20 minutes, 15-20 minutes of assessment, moving, maybe some light tissue work to just identify inflammation, identify pain, identify movement, and then we're targeting specific areas that we're gonna use the localized cryotherapy. So that's a 25-minute, 30-minute block that I have, which is $75.
Yeah.
And then as an add-on, the next question is, how much do I charge it as an add-on? My 1 hour sports manual therapy is I charge $135 for the hour, and if you want to add the cryotherapy, it's $30. So it's a $30 add-on on top of my hourly session.
That's great. Yeah, that's a good price range for your treatments. So for anyone out there who's in New York and wants to try cryotherapy, you are located in Astoria, New York, correct?
Yes.
Dr. Lee?
Yeah.
All right. So go ahead, and Dr. Lee, we honor your time and we value what you do and giving us the time out of your day. I know you're busy, and so I wanna go ahead and thank you, tell you thank you for joining us today. But go ahead and promote your business and tell us where they can find you, what's your social media handle, so people can support you.
Yeah, so guys, you could follow the Recovery Mode NYC. We're located in Queens, Astoria, Queens. We provide sports recovery for active people. If you're an active individual, that you feel like you need some relief, you want to recover faster, you want to integrate recovery into your fitness routine. That's why we're here. I think there's people asking a few questions down here.
Go ahead, Dr. Lee. Take it away.
But yeah, no, our focus is to keep active people active. Our goal is to, provide customized treatments for these individuals. And we have a wide array of recovery technology, recovery services. Our goal is to continue to grow, continue to keep people active, keep people in the gym, keep people moving, keep people away from a sedentary lifestyle, and then just that, keep people moving around. Health is wealth. That's what we always say.
Yes.
Prevention is better than a cure. So that's what we strive on. We want people to really grab a hold of their health and be less reactive and more proactive with their health.
Yes, thank you. So if you have any more questions for Dr. Lee, feel free to follow his Instagram. I know your Instagram handle is the Muscle Doctor.
Yes, so that's mine. And then Recovery Mode is the clinic.
It's the business. Yes. Yeah. So Recovery Mode. I like that. The Muscle Doctor.
Yeah, I like muscles. I like.
Yes. That's a good one. So follow Dr. Lee, the muscle doctor, and recovery mode. If you have any more questions about what he does and all the information that he can bring value to you, please go ahead and shoot him a message if that's okay with you,
Yeah,
Dr.
definitely.
Lee. All right. But anyway, thank you everyone for joining us tonight. Today it's 3 o'clock, 3:37 here in Washington State, and I know you're at EST, so in New York. So thank you everyone for joining, and we'll
Thank you guys.
reply to your questions, the rest of the questions in the live chat. All right. Thank you. Have a good night, Dr.
Good
Lee.
night.
All
Bye.
right. Bye.